Process issues, countertransference. These are all the feelings that the therapist has towards the patient. Identifying countertransference has some purpose behind it. It reduces the chance of acting on it. It will help us identify any transference, help us treat the patient better. It can help the therapist know about themselves. Two types of countertransference. First is concordant, where you identify with the patient. The therapist identifies with the patient. Complementary, where the therapist identifies with other relationships or other people in the patient's life. The therapist looks out for how they feel towards the patient. They also look out for anything that they're doing in relation to the behavior with their patient. And if there are any similarities in something that is going on in the session and something that is going on in the patient's life. Reflecting on the transference, the therapist would want to understand if the countertransference is helping them understand how the patient is feeling, or if it is helping them identify if there is any resistance that they sense, or if they are able to understand their own emotional experience or their own history. So, reflecting then helps us identify when and how to intervene. Sometimes the therapist can share their feelings or feelings of countertransference with the patient when it is socially appropriate, like congratulating them or saying that they're sorry for their loss. Next, if the therapist feels that they are concerned about the patient's safety, or sometimes they feel that the patient should see a doctor for a certain physical concern. So, this would be sharing some strong medical opinion or something that they feel about the patient's well being. Um, or sometimes they might also try to bring up the patient's feelings by checking how they feel that the therapist might be feeling in a particular situation. Countertransference will also guide on whether to take a supportive approach or whether to take an uncovering approach.